Good morning, everyone. My name is Ákos Mátrai, and I would like to hold my presentation about my 6 months progress report of my PhD work at the Center of Translational Medicine. My research topic is the effects of maternal infectious disease drug treatment during pregnancy on fetus and on pregnancy outcomes. I work as a specialist at the Department of Obstetrics and Gynecology, and my vision is to provide the optimal pregnancy care that contributes to the birth of healthy fetuses, and my mission with my PhD work is to highlight the risk of infectious disease during pregnancy. First of all, I would like to show you an overview about my two ongoing topics. First is a systematic review and a meta-analysis, and the second will be a registry analysis. Let's begin with my first meta-analysis project, which is the investigation of the effects of maternal influenza during pregnancy on birth defects. A few words about the background. Influenza is a really common infection. Every autumn and winter there are around 50 million illnesses worldwide. According to the Central Statistical Office, there are about 400,000 cases in Hungary every year. We know that the birth prevalence of congenital malformation can be estimated at 3 to 5%, and these disorders underlie around 25% of perinatal mortality. Our aim with this study is to assess the effects of maternal influenza during pregnancy on birth defect. Our clinical question is, does the influenza increase the number of congenital malformations in the pregnancy? As on the slide you can see, we are investigating the presence and the absence of influenza during the pregnancy, and the outcome of the study is the non-chromosomal birth defect. The hypothesis is that the influenza occurring in the first trimester increases congenital abnormalities. As the first step, we made the systematic search in 3 databases, and after that we made the selection and the data extraction. On the next slide, I will show you the results of the meta-analysis. On the first slide is our first outcome, which is the cleft lip and palate. Orofacial clefts are common birth defect with an estimated worldwide incidence of 1.7 per 1,000 live births. Babies born with these kind of malformation have feeding difficulties, have speech problems, and are often developing conductive hearing loss. So we investigated, as you can see, 4 studies. The heterogeneity was quite low. After the analysis, we got that the odds of having cleft lip and palate is 2.4 times higher in the influenza-infected group than in the healthy group. It means that the pregnant woman who had flu in the first trimester has 2.4 times higher chance to have a baby with cleft lip and palate. On the next forest plot is about the neural tube defects. Neural tube defects are birth defects of the brain and spine or spinal cord. They happen in the first months of pregnancy, often before a woman even knows that she is pregnant. As on the slide you can see, we investigated 4 studies. The heterogeneity was 0. After the statistical analysis, we got that the odds of having neural tube defect is 2.4 times higher in the influenza-infected pregnant group than in the healthy ones. The results are significant. And on the last slide of the results, we presented the congenital heart defects. Congenital heart disease has been the most prevalent birth defect, and it remains to be an important cause of neonatal and infant deaths. As on the slide you can see, we investigated 3 studies, and the odds of having congenital heart defects is around 1.4 times higher in the influenza infected group than in the control ones. It means that the pregnant woman who had flu in the first trimester has 1.4 times higher chance to have a baby with congenital heart defects. Let's see the strengths and the limitation of the study. The strength of the study is the rigorous methodology. This will be the first meta-analysis focusing on influenza infection in the first trimester, and the articles come all over the world. Among the limitations, we have to mention that the influenza definition based on symptoms, and the most cases are self-reported influenza infection. I would like to summarize this project. After the analysis is the conclusion that the influenza in the first trimester plays a role in the developing of non-chromosomal congenital abnormal malformations. The implication for practice is good to mention. If flu is presented in the critical period, great emphasis should be placed on prenatal screening. We should make efforts to prevent flu during pregnancy and vaccinate against influenza. After my first project, let me present my second ongoing registry analysis, which is the investigation of the effects of maternal influenza during pregnancy on birth defects in Hungarian population between 1980 and 2009. As I mentioned before, the influenza is a very common disease that occurs during epidemic outbreaks between December and March. The non-chromosomal birth defects are 4.5% of live births in Hungary, and they cause 25% of perinatal mortality. Our aim with this registry analysis is to assess the effects of maternal influenza during pregnancy on birth defect in Hungarian population between this term. Our clinical question, our PICO, and our hypothesis is the same as I mentioned in the meta-analysis. Just a few words about the database. This database is the Hungarian case control surveillance of congenital abnormalities. It is unique in the world. It was established in 1980, and it contains data about 90,000 pregnancies. On the next slide, I would like to present a quick look to the most important data which we got after the analysis. First, we verified that the influenza in the first trimester is a risk factor for developing of congenital malformation. After, as on the slide you can see, we examined what kind of birth defect can develop if flu is presented in the first trimester, and we divided them in 3 big groups. These are neural tube defect, cleft lip, and the cardiovascular malformations. Now this is the progress of the registry analysis. We are now in the preparation of the article period. At the end of my presentation, let's see again our 2 ongoing projects. We would like to submit them end of this summer. And finally, I would like to close my presentation with a quote from Steve Jobs. Sometimes when you innovate, you make mistakes. It's the best to admit them quickly and get on with improving your other innovation. Thank you for your attention.
Congratulations, Ákos. It was a fantastic presentation. I'm just, I was thinking a lot about my question because I'm trying to figure out whether, I mean, now you are investigating influenza. We were discussing that not the virus, but the fever is actually causing the malformation. But some of the pregnant women will have fever, but the fetus won't develop actually abnormality. I'm just thinking whether there are any other factors that influences or is an additional risk factor beside fever that can actually cause malformation. Or is it really the fever, for example? And I'm also thinking about this because right now, besides influenza, there is also COVID-19, which can cause fever, and I'm expecting then that it should have the same proportion of malformation. I don't know if you know any other prognostic factors for this.
After the analysis, we got that the fever is the most important thing in this topic. So we didn't find any other factors with the influenza. So in the first trimester, the fever is the most dangerous cause for the congenital malformations. So we have to give the patient antipyretics. We have to vaccinate them to prevent the influenza and this fever. If influenza is presented, the fever is necessary. So we have to prevent the influenza.
Of course, Ákos answered this very clearly, but you have to know that if fever is present of any cause, if fever is present at the first trimester, the same things happen. And the adequate use of antipyretics may diminish this deteriorating effect of fever, so fever is the cause. And we don't have enough data also, already analyzing the effects of COVID infection, but for sure the same thing will happen with that also.
Thank you for your presentation. I wanted to ask you about the vaccination. Would you advise women to be vaccinated at every stage of the pregnancy, and are there any gynecological contraindications to the vaccination?
Influenza vaccination,
yes.
Yeah. We offer them, and it's necessary in every time in the pregnancy. They have the chance to have the vaccination. We have to highlight the risk of the influenza, and we should offer them.
But there aren't any contraindications, gynecological
No, by COVID vaccination, we offer after the first trimester. It's the best if we offer every drug after the first trimester, is the best, but influenza vaccination are safe.
Congratulations, Ákos. So you mentioned as a limitation of your meta-analysis that the diagnosis of influenza was based on only the symptoms. But is there any study included in your meta-analysis where these suspicions were confirmed by any laboratory test?
Yeah, there was one study, but we excluded it because they use data not just from the first trimester.
Okay, thank you.